I think it's a really interesting time for healthcare because the model that we've generated last century is failing us. The health problem that we're trying to address is no longer battlefield trauma or infectious disease, it's chronic disease, and how do we get preventative? And the reason countries around the world care is because health is becoming unsustainable as expenditure increases. Ageing population, chronic disease. So technology has a huge role to play. We've spent a lot of time and expense over the last couple of decades digitising healthcare, and now we've got so much data that humans can't process it. So we actually need to bring technology in to assist our care providers. We have workforce shortages and burnout around the world. We need to bring technology in to make that model more effective.
So why is Microsoft now active in this space, and two companies that have long been involved in healthcare, Siemens and GE, backing out of this space? What can you do that they can't do?
Yeah, we've been active and verticalised in healthcare for 15 years, but the big shift recently is as we start to take health data into the cloud, that allows us to bring powerful new technologies like artificial intelligence to bear. So it's creating different opportunities for some organisations who are cloud first and AI first, and other more traditional companies are under siege from that shift.
Simon, you've been, Microsoft as a company has been looking around precision treatments for some of these chronic diseases and illnesses that you've mentioned. From the initial research you've done, from the initial testing you've done, what kind of promise is the technology holding in terms of curing things like cancer and some of these other degenerative diseases too?
Look, precision medicine is incredibly exciting. We've always and historically said, radio, you have a disease, we treat it with this, and if this doesn't work, we try second and third line agents. Precision medicine means that you can know enough about the person, maybe it's their genome or maybe it's a whole lot of other information, to be able to diagnose it right the first time and know how they're going to respond. And getting that balance right is incredibly data and computationally intensive.
Does AI and the cloud technology using offer promise for cures to some of these chronic diseases though?
So precision medicine we're seeing first and foremost in cancer care, oncology, but very quickly this is going to extend to all sorts of chronic disease, autoimmune disease and chronic infections too.
There's been a lot of criticism actually about Microsoft and Google's inability to really monetize their disruptive moves into this sector. And Simon, you'll recognise some of this, and the concern is actually that you fail to acknowledge just how deeply entrenched vested interests are in this industry, and also the complexity between agencies that are active in healthcare. To what extent do you accept the criticism and have a solution moving forward that brings your business and other tech businesses into this arena without having a full stand-up fight with the entrenched interests?
Yeah, that's fair. We have a model that has a commercial business today and a research business tomorrow. And within our research business, we will always try to broker new models that we think have promise. And the one you're specifically talking to that Microsoft and Google both believed in was the shift to personal health records. That if consumers had their own information, they would become empowered and they would take ownership of their own care. And to an extent, that's not a technology failing, it's more of a societal and a demographic understanding about how the asymmetry of information between patients and providers and how ready patients are to step up and manage their own care. But it won't stop us continuing to take risks and push the envelope of new models, because if our health system is unsustainable today, we'll only address it by brokering those new models of care. So things like telehealth, precision medicine, artificial intelligence, even mixed reality, these things are really important.
Hey everybody, it's Hadley Gamble from our new CNBC Middle East Bureau in Abu Dhabi. Thanks for stopping by. Now to watch more, you can try one of the videos that just popped up on your screen. And don't forget to subscribe.